First, remove the CSR-wrapped unit from the outer bag. Fill the water seal to the 2-centimeter line with the 45 milliliters of prepackaged sterile water provided with each drain. Simply remove the prepackaged sterile water ampule from the back of the drain, twist off the top, and insert the tip of the water ampule into the suction port. Empty its entire contents by squeezing the ampule until all the water empties into the drain and fills the water seal to the indicated fill line. Discard the ampule. Next, connect the chest drain to the patient by inserting the patient tube connector directly into the thoracic catheter. The patient is now on gravity drainage or to water seal. To apply suction when prescribed by a physician, connect the suction source vacuum line directly to the chest drain's suction port located on the top of the drain. Turn the suction source on and increase the vacuum to at least -80 millimeters of mercury or higher. A suction monitor bellows provides visual indication of sufficient operating vacuum levels for best performance. The suction monitor bellows must be expanded to the delta mark where indicated, or beyond for a standard -20 centimeters of water or higher regulator setting. Visual expansion of the bellows across the suction window will confirm adequate suction operation. The Oasis suction regulator is preset to a -20 centimeters of water suction pressure level directly out of the package. Changing the regulator suction control setting is easily done by adjusting the rotary suction control dial located on the side of the drain. Simply dial down to lower the suction pressure setting and dial up to increase the suction pressure setting. The drain must be placed below the level of the patient's chest and kept in an upright position to maximize drainage efficiency. The integrated flexi hangers accommodate today's newer bed designs and allow single hand placement and transport. All patient tubes and suction connections should be routinely checked to ensure proper leak-proof operation and chest tube patency. Like all Atrium models, the Oasis 3600 single drain collection chamber incorporates a large writing surface with big, bold numbers and easy-to-read fluid level graduations. The first collection chamber column is calibrated in small 1 ml increments up to 100 milliliters in brightly colored bold numbers, then in 2 ml increments up to 200 milliliters. Subsequent collection chamber columns are calibrated in 10 ml increments up to the maximum drain capacity of 2100 milliliters. Monitoring a patient's chest drainage system, it's important to periodically check the water seal's operation and fluid level. If the water seal is either underfilled or overfilled, it should be adjusted accordingly to the prescribed maximum 2-centimeter level. Using a 20-gauge needle with syringe, adjust the water level via the grommet located on the back of the water seal chamber. In the event of an accidental knockover, upright the drain immediately and check all fluid levels. If required, the water seal level may be adjusted back to its original 2-centimeter level as previously demonstrated. If a knockover does occur, fluid drainage could potentially spill from one collection column to another. If this occurs, gently tip the drain to the right to return fluid back to the correct column and then upright the drain. The Oasis features an advanced water seal design for maximum knockover protection, even when connected to suction. In the event of an accidental knockover, its knockover nozzles helps minimize interchamber spillover. The patient tube slide clamp must remain open at all times during system operation. It's recommended to position the patient tube clamp next to the inline connector for setup convenience and routine visual check. The patient tube clamp can be removed if desired. Samples can be taken directly from the needleless Luer lock sampling port located on the patient tube connector. For patient transport and gravity drainage applications, simply disconnect the suction source vacuum line from the suction port. Assessing patient air leaks is easy with Atrium's blue tint water and graduated air leak monitor. Continuous bubbling observed in the water seal will confirm a persistent air leak in either the patient's thoracic cavity or possible tube connections. Intermittent bubbling with gentle float ball oscillation will confirm the presence of an intermittent air leak, and no bubbling with minimal float ball oscillation at the bottom of the water seal indicates that no air leak is present. Bubbling from right to left in the air leak monitor must be present to confirm an active air leak. The Oasis Graduated Air Leak Monitor allows visual detection of air leaks from a low volume of 1 to a larger air leak volume of 5. Air bubbles passing through the graduated air leak monitor help the clinician assess air leak patterns and patient air leak trends.